Hello and welcome everyone to the Phase 3 track. I'm Beth Ludwig and I'll be your moderator for this session. I'm going to start off with a short introduction and then I'll move on to introduce our speakers. So in this figure, we're looking across the drug development phases, and in Phase 1, studies are small. They include healthy volunteers and have a primary aim to learn about safety, tolerability, and pharmacokinetics. In Phase 2, the studies are larger and do include patients, but the trials are not large enough to demonstrate overall safety and rarely compare the drug to the current standard of care. In Phase 3, the trials in patients are larger and of longer duration, and the drug is compared to an existing treatment or placebo. So in Phase 3, if a population PK or exposure response model has been developed, it can be applied to help support responses to questions that need to be addressed prior to regulatory submission. So as an example, covariate assessment could be performed using a PopPK model and Phase 3 data to help confirm that the effect of hepatic impairment does not have a significant influence on drug PK. Similarly, confirmation of an exposure response relationship using the primary endpoint from a Phase 3 trial could help to support dose selection. So both of these examples that I've used are focused on population analysis, but in this Phase 3 session today, our speakers will be discussing a wide range of modeling and simulation approaches that use a variety of software tools, all of which can be applied in model-informed drug development in Phase 3. So our first speaker today will be Julie Passarell, Assistant Vice President of Statistics for Simulations Plus in the Cognigen division. And her topic will be pharmacometrics in Phase 3, data integration and analysis to support dose and labeling for the NDA. Our second speaker is Maxine Lamerty, Senior Scientist at Simulations Plus in the Lancaster division, and he'll be focused on pregnancy PBPK modeling, a necessary step towards safety and efficacy. And then our third presentation is going to be a team approach with two speakers. The first speaker is Paul Watkins, the Howard Q. Ferguson Distinguished Professor of Pharmacy at the University of North Carolina Institute for Drug Safety Sciences. And the second speaker is James Bodwin, a scientist at Simulations Plus with the DILIsym division. And their topic will be quantitative systems pharmacology modeling provides novel mechanistic insights into disease-related tolvaptan hepatotoxicity. And the fourth presentation will be given by Sarem Sarem, Senior Biostatistician of Pharmacometrics with Health Canada. And he will focus on regulatory perspectives for reliable model-informed drug development. After those four presentations, we'll have two poster presenters. The first is Hannah Huang, Assistant Director of Pharmacometrics and Simulations Plus in the Cognigen division, and her topic will be concentration QTC analysis of quizartinib in patients with relapsed refractory acute myeloid leukemia. And the second will be Luann Phillips, Distinguished Scientist in Pharmacometrics at Simulations Plus, the Cognigen division, and her topic will be population pharmacokinetic evaluation and missed dose simulations for S-carbazepine acetate monotherapy in patients with partial onset seizures. So we have a great group of presentations coming up. I just wanted to mention that our first presenter, Julie Passarell, could not be with us today, so she has pre-taped her presentation. So in order to listen to it, all of the attendees need to leave this meeting and then join Julie's presentation. And I wanted to mention that that will be our only presentation in our Phase 3 session where we won't have a Q&A session after the speaker finishes. So I'm going to end at this point so that everybody can move over and join Julie's presentation. Thank you, everyone.